Can you just talk about kind of your history? What kind of led up to you being where you are today?
Sure. Well, I'll give you just a quick overview. So we were just doing new employee orientation, Todd Smith and I, and it's pretty funny because he's the president here at Mercy Reading. Both he and I were born here at Mercy. So I started here at Mercy Reading literally, and then grew up in the Shasta community, had a chance to ski up in Siskiyou County and backpack and ride quads in Tehama, and then now with Sierra Nevada coming into our new Northstate market of hospitals, I actually have cousins that live there. So just a great connection with the community. Went to college, went to LA, came back and started here 35 years ago, and then have just worked up through the market. Both my kids, my son and daughter, were born here, and had an opportunity to become the Chief Operating Officer at Mercy Reading, and then from there to President at Mercy Mount Shasta, and then 4.5 years ago, President at both Mercy Mount Shasta and St. Elizabeth, and now the Market President for the four.
And what do you think it is about you that's lent itself or is kind of the reasoning behind why you're in this position now?
Well, I don't know if it's so much about me. I have great teams and have great people that I get to work with. We have great staff and great physicians. And so one of the characteristics that I have is collaboration, and I also like different views. And I think when we have leaders, physicians that speak up and have different thoughts, instead of us just all blindly going one way and agreeing that, oh yeah, that sounds right, I think we make better decisions together for the healthcare of our community, and we challenge each other to get better.
Okay. And so, yeah, as someone who has such a deep connection to the North State, now that you're kind of the man in charge of the Dignity Health facilities here, where do you see Dignity's role in the North State going forward?
Well, I think we have been primary in care for these communities for years, and we want to continue to do that. It's our mission, it's what we do. So we want to continue to grow in areas where the community has needs. And part of that is the new regional cancer center that we're working on. That's going to be a huge improvement for this community. It's going to tie in. Right now we have cancer sites in Reading, but they're spread out. Put it in one location, easier for the patients. We have a cancer center in Red Bluff, medical oncology infusion that will link in here because we can't do everything down there. And then in Mount Shasta, we don't have any cancer services like we have here. So a lot of our patients come already, but it's, like I said, it's intermittent. So connecting those together is going to be phenomenal and great for all of these three. And then Sierra Nevada, we actually have a great cancer center over there as well, serving that community. Cancer is one of the primary needs in all of our communities.
Yeah, and so going forward on that, I do want to ask, is there plans maybe in the future to, because it's a long drive from Mount Shasta to here, is there plans to maybe expand their cancer operations once this cancer center is up and running as well?
We've looked at that, and I think we always continue to look at what does the community need. And so physician recruitment is challenging, and there are fewer physicians coming out. So what part of what we're doing is we're focusing on centers of excellence. And there's a possibility that we could do pieces. We looked at maybe infusion connection or medical oncology for the visit. And one of the things that's happening with technology is televisits. So that probably is the next step for us. When we get this cancer center here, the best way to serve some of those patients right now or more emergent would be to do a televisit. So they can come down and have their doctor here, but maybe not have to travel every time. And then from that, we'll continue to build as the needs are there.
Okay. And then I've heard it kind of a few times, but could you kind of go more into what do you guys mean when you talk about these center of excellence for medical care?
So centers of excellence is having, if we can, all the services connected. If you've ever had a serious health issue, and you have to go to one location and you got to go somewhere else to pick up another piece and go see another specialist elsewhere, that can be really confusing, and it's hard for the patients to get around to make those appointments. So a center of excellence, if we have like a navigator that can help link that with the family, if everything's not in one location, but help that is one. And then the quality. So like our regional cancer center we've talked about, with cardiac here, Mercy Reading has a connection with Stanford, so we're trying to elevate that. And how do we partner? how do we partner with other groups to provide that excellent care right here in our local communities.
One more, it's a softball question, kind of surprised. I was recently going through a lot of the medical complaints and violations that are tracked by the California Department of Health. And dignity facilities across the board really haven't had any in the last couple of years. What do you think it is about your guys' facilities that lends itself to that?
Well, every facility, and again, I referenced our new employee orientation, and that's part of actually what makes us great, I think, is we're looking for the right culture. And our staff, our physicians make that culture. And a couple of things we focus on is the patient experience and HRO, which is a high reliable organization focusing on zero harm, zero avoidable harm. And I think that's part of what's making that difference, because we tie that in with our staff and our doctors, and it's not a flavor of the month program. We want them that if they see something, it doesn't matter who they are, what position, if they see something that looks unsafe, to ask that question. And again, the goal is to have zero harm. So are we perfect? No. We sometimes have things that happen that we wish didn't. But again, we treat everybody as if it's our family, friends, neighbors here. And so if something bad happens, we learn from it. That's what a high reliable organization does, because you want to make sure that it doesn't happen again. But our goal is 100% every patient, every time. That's kind of a mantra that you'll hear from our hospitals. It's every patient, every day, every time. It doesn't matter if we were great in the past, great yesterday. A number of our hospitals, 2 of them are leapfrog grade A. Mercy Redding's just moving into a B. And then Shasta Critical Access, they don't do leapfrog in critical access, but they are a 4-star, CMS 4-star hospital. So really high, but that's only as good as what we were yesterday. So it's every patient every day, because today, what type of care are we delivering?
Okay. Well, that's the extent of questions I had. Anything else you feel is important to mention? Anything else you wanted to say about this?
I think this is just, again, I'm humbled, I'm excited. What a great opportunity to serve these 4 communities where I grew up. It's just a dream come true.
Thank you so much.
Awesome.